So let me first say salam alaikum. I'm very happy to be invited virtually to the conference, and so let me start my presentation. If anybody is logged in by Zoom, you could write in the chat. But right now, talking through the microphone is very hard for me to understand. But anyway, so let me, we've done a lot of preparing here. So let me start my presentation. And if you lose my voice, just send me a WhatsApp. Okay, so what I like to today is ethical considerations for COVID-19 mandatory vaccine. So what is the problem? Why do we need a lot of people vaccinated? Well, we're experiencing the recent surging Delta variant cases. And despite vaccines being widely available since spring in several countries, thousands of people are dying every month because they have chosen not to be vaccinated. Also, vaccination levels at around or just under 60% are inadequate for herd immunity, and most countries under 60%. So if we take a look at the data on the top row here, we see UAE is 86%, so they're at or approaching herd immunity. In the US, we're below 60, 56.7, and Egypt is 8% vaccinated. Of course, that also depends on the supply, and I'll get back to that in just a few minutes. So again, the problem is there's growing controversy over whether a vaccine mandate can be instituted, or is it ethical to institute a mandate for vaccines. So and if you look at the newspapers, there's a variety of responses. Here, about a month ago, we see COVID Melbourne construction workers protest vaccine mandate, and Biden's an editorial in the Washington Post. Biden's vaccine mandate is a big mistake. So now Egypt is not far behind. This is a recent newspaper clipping. Egypt imposes a vaccine mandate for all government workers and university students. Authorities aiding the delivery of tens of millions of doses of COVID-19 vaccine have issued a sweeping vaccine mandate that encompasses a broad segment of society, including teachers, government employees, university students, and people seeking any government services. I believe this vaccine mandate is to take effect just a few days. It is not uncommon for government institutions to mandate certain actions or types of behavior in order to protect the well-being of individuals or communities. Such policies can be ethically justified, as they may be crucial to protect the well-being of the public. Nevertheless, because policies that mandate an action or behavior interferes with individual liberty and autonomy, they should seek to balance communal well-being with individuals. So essentially, how do we balance this tension between individual rights and public health during a pandemic? So how to balance? Well, there are utilitarians for vaccine mandates claiming that higher immunization rates results in greater good for all lives. In other words, enhanced the common good. According to you, mandating personal vaccination is morally because of the consequences. Again, the utilitarian argument, community protection and reduction in virus transmission results in lower rates of infections, hospitalizations, and deaths. However, critics of utilitarian tend that it to consider the principle of utility to be fundamental and not to consider that other values do not have the same moral value, such as individual liberty, autonomy. Now, the real mandates are shown in this slide. It is just for society to take actions that infringe on the rights of others to live a prosperous life. For example, governments from a lot of countries restrict smoking. Also, for vaccine mandates, it will result in lower transmission rates, herd immunity. Also, on the principle of beneficence, healthcare workers have a moral obligation to provide safe care for patients and to do no harm. Vaccination would limit the spread of COVID-19 infection and enhance patient safety if healthcare workers are vaccinated. Also, on the principle of justice, where vaccines are widely available, equity concerns argue in favor of vaccine mandates because disadvantaged communities have been disproportionately harmed by the COVID-19 illness. Also, vaccines prevent hospitalization and may reduce healthcare worker shortage and protect health system to admit other types of patients. This would enhance distributive justice and enable healthcare organizations to fulfill their obligations to the sick and vulnerable segments of the populations. Now, arguments against vaccine shown in this slide: a mandate with no exemptions would infringe upon personal autonomy. Mandates eliminate the right to informed consent or refusal of treatment. A vaccine mandate counterproductive, negatively affecting staff morale and violating trust when stress levels among healthcare workers are already high. Vaccine mandates would represent a new form of institutionalized segregation between the vaccinated and the non-vaccinated. Also, it would create new and deeper fractures within society. And the last one against a vaccine is a lot of people saying they need clearances of safety. So again, how do you balance? So the only way to balance this common good versus individual liberty is you have to use a public health framework. And this slide shows the important components of a public health framework. It consists of maximizing health, efficiency, proportionality, social justice, and respect human dignity. So let me go through these components one by one. So in order to have a mandate, you have to have sufficient evidence of vaccine safety. Essentially, data should demonstrate the vaccine data has been found to be safe in the populations for whom the vaccine is to be made mandatory. When safety data are lacking, or when they suggest that the risks associated with vaccination are greater than the risks without the vaccine, the mandate would not be ethically justified. In the absence of sufficient evidence of safety, there would be no guarantee that mandating vaccination would achieve the goal of protecting the public health. Also, to be sufficient evidence of vaccine efficacy and effectiveness. Data on efficacy and effectiveness shows that the vaccine is efficacious in the population. Vaccination is to be mandated, and that the vaccine is a means of achieving an important public health goal. For instance, if mandatory vaccination is considered necessary to interrupt transmission harms to others, there's sufficient evidence that the vaccine is efficacious in preventing infection or transmission. Alternatively, if a mandate is considered necessary to prevent hospitalization and protect the capacity of the acute healthcare system, again, there should be sufficient evidence that vaccine is efficacious in reducing cases. There should also sufficient supply. If you don't have sufficient supply, it doesn't make sense to have a mandate. In order for the supply of the authorized those whom it is to be made mandatory. So essentially, if you're going to make a vaccine mandated, it needs to be free to the population. Burdensome, unfair demand on those who are required to be vaccinated but are unable to access the vaccine. Also, you have to think about the public trust with these mandates. Policymakers have a duty to carefully consider the effect that mandating being vaccinated could have on public confidence and public trust, and particularly on confidence in the scientific community, well, maybe the committee too, and public. Such a policy threatens to undermine public trust. It might affect both vaccine uptake and adherence to other public health measures, which can have an enduring effect. And finally, I wanted these two terms to have a vaccine mandate. You have to show that it is necessary and the means are proportional. So what do I mean by that? Mandate vaccination should be considered. It is necessary for and proportionate to the achievement of an important public health goal. Proportionality indicates that the means, and in this case, the mandate must be proportional to the severity of the public health threat. So if you're going to institute a mandate that threatens liberty, there has the extent that those means be proportional to the of the public health threat. Now, I think we can agree that we satisfy the principle of proportionality, and the next step is it necessary. If such a public goal can be achieved with less coercive or intrusive policy interventions, for example, public education, a mandate would not be ethically justified. It's not necessary. The goal is to achieve public health goals with less restriction of individual liberty and autonomy. So essentially now with this debate, do we coerce people to get them, or could we use least restrictive means, for example, in terms of persuasion? Again, could we use least restrictive means? So essentially, what are the availability of options? If the use of personal protective equipment, physical and physical barriers prevent the spread of COVID-19, and these options are for the healthcare workers, then mandating that vaccination may not be ethically warranted. When other alternatives exist, coercion in the form of a mandate, specified threats, or other significant net consequences for refusals may not be just. Other alternatives, again, education campaigns, inducement in the form of huge monetary incentives, and then let me go over this concept of nudges change behavior by means of choice organizing the context in which people make decisions. For example, you could limit the choice. Even in a nudge, even libertarians embrace the concept of libertarian paternalism, prioritizing personal freedom. That's libertarian, limiting choice to bring about better results. Limiting choice is paternalistic, but you will still have free choice among the choices available. Also, there was a recent paper entitled Behavioral Nudges Increase COVID-19 Vaccination, and this showed the benefit of continual text messages, reminders about getting vaccination. Text messages is considered a nudge. So the other thing to consider is, who are the unvaccinated people? The unvaccinated people may not be who you think they are. And let me explain. So what are the reasons for vaccine hesitance? Well, real-time data has refuted predictions about how people would respond to a vaccine mandate. In a recent poll, 72% of the unvaccinated said that they would quit if forced to be vaccinated. And news articles warning of mass nations. However, when large employers, schools, hospital system finally put in a vaccine mandate, people got vaccinated overwhelmingly. So all of the unvaccinated truly believed that vaccines were that dangerous. Most of them would have quit. Other things to consider is that the remote success of vaccine mandates show it is not a firm ideological commitments that have kept everyone from getting vaccinated. In other words, the people who hold on to ideology about the vaccine and are very firm libertarians in having their freedom, it really represents a small portion of the unvaccinated people. Research shows that a significant portion of the vaccinated public are concerned about side effects and absolutely oppose the vaccines. The unvaccinated overall. Now, another reason for vaccine hesitancy is that we don't have much trust in the institution and authorities. So you have to enhance the public trust in order to decrease vaccine hesitancy. And also, in a lot of testimony from unvaccinated people who are very sick with COVID, and when they realize they are dying, they are telling people, get vaccinated. So these are pictures of confusion, not conviction, in terms of not getting vaccinated. And also there's the fear of needles. So my conclusions, let me get back before I take a bow. Yes. This mandatory vaccination should be supported by the best available in a manner that is transparent, fair, non-discriminatory, and the input of affected parties. Policy should use arguments to encourage voluntary vaccination against COVID-19 before contemplating mandatory vaccination. Stricter regulatory measures should be considered if these least restrictive means are not successful. And finally, a number of considerations should be explicitly discussed and addressed through ethical analysis when considering whether mandatory COVID vaccination is an ethically justifiable policy option. So with that, let me say, Shukran, thank you very much for your attention.